Hi, my name is Vicki Sims, and I'm with Gainesville Physical Therapy. So you've been diagnosed with a sacroiliac joint dysfunction. How would you treat this? And I would like to tell you how you would treat it. An SI joint dysfunction, of course, is when the ilium is moved out of alignment and locked in an abnormal position, or the sacrum is in an abnormal position. Here at Gainesville Physical Therapy, we have 3 lines of treatment. The first is I have developed a stabilization protocol. It's a 6 to 8 week protocol where the SI joint is aligned by a therapist, myself or someone else. We teach you how to self-correct. We do a specific type of taping technique. Sometimes we use an SI belt, and we teach pelvic stabilization exercises. You progress through the 6 to 8 week protocol, and in most people that I see, the SI will stabilize with the conservative protocol. If the SI joint is not stabilized after the protocol, then we can consider other more invasive treatments for the SI joint dysfunction. The next line of treatment would be prolotherapy and or PRP. That is when an irritant is injected into the ligaments of the SI joint, and it sets off an inflammatory response, which then sets off a healing response, and it will help the ligaments of the SI joint to tighten and hold the SI joint in alignment for longer periods of time. And there's a certain protocol that you use when getting prolotherapy, and there's many physicians around the country that do prolotherapy, and many of them have their own protocol. The third line of treatment is for surgical intervention. And for more information on the surgical intervention, you can see the link at the bottom of the page. Now, the question that I get asked most often after the conservative program has been tried is, how do I know should I progress to prolotherapy and or surgical intervention? This is basically the rule of thumb. If the SI joint can be placed into position and can remain there for a couple of days at a time, then usually prolotherapy is very effective. I have found clinically, if the SI joint will not stay in alignment, not even for 24 hours, then usually prolo is not as effective, and sometimes you have to pursue surgical intervention. Thank you.